Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance and Minimize Injuries. Thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report. Please feel free to visit my website, championshipchiropractic.com, where you can get additional information on the book and you can connect with me on other social media platforms. Please enjoy this sports medicine video. The topic of today's Dr. Ozello Sports Medicine Report is on carpal tunnel syndrome. This is a topic that we hear about over and over and over and over and over and over and over again. Most of the time we think about it as being an occupational type of an injury. And it definitely can be, but it is also a sports injury. Carpal tunnel is the number one neural entrapment injury in sports and in all walks of life. So it's extremely important that I go over this and let everybody know what exactly carpal tunnel is, the contributing factors, the symptoms, and what you could do to prevent this condition and what you can do to recover from this condition. Like I said, this is a common injury in sports. It happens with weightlifters, cyclists, mountain bikers, football players, wrestlers, even wheelchair athletes. In most cases, carpal tunnel syndrome is caused by repetitive wrist and hand motions and poor wrist and hand positioning. Keeping the wrist and hand in the same position for too long. Carpal tunnel syndrome is the most common entrapment neuropathy in sports. It is impingement and traction of the median nerve in the carpal tunnel right here. It causes symptoms which are numbness, tingling, weakness, and paresthesia. Paresthesia is pain and burning. These symptoms occur along the distribution of the median nerve. The distribution of the median nerve in the hand is the thumb, the index finger, the middle finger, and the lateral part of the ring finger, or the part of the ring finger basically that is closest to the middle finger. I'm going to give you a quick anatomy lesson so you could picture the carpal tunnel in your head and understand this condition a little bit better. The carpal tunnel is located in the wrist. It is an osteofibrous outlet between carpal bones and a structure called the flexor retinaculum. The carpal bones are the bones in the wrist. The borders of the carpal tunnel on the medial side, the posterior side, and the lateral side are the carpal bones. The border on the anterior part of the carpal tunnel is a structure called the Transverse Carpal Ligament, which is the thick central part of the flexor retinaculum. Now, there's not much room in the carpal tunnel. The median nerve goes through it, and also 9 flexor tendons of the hand go through the carpal tunnel. The flexor muscles do this right here. So the tendons along with the median nerve are passing through the carpal tunnel. So there are a large number of structures that are going through the tunnel, and there's not much room. The contributing factors of carpal tunnel syndrome outside of sports are fairly well known, but I'm going to go over those. First of all, it's repetitive motions, repetitive tasks of the wrist and the hand. Like I mentioned before, also holding the wrist and the hand in one position for too long. Poor wrist and hand positioning. There can be pressure placed on the carpal tunnel. There can be a force directed towards the carpal tunnel. This can come from computer work, where we're typing for an extended period of time, we're mousing, we're using our smartphones, holding video game controllers, vibrations. All types of things can cause this condition. We do everything in the front. We are constantly gripping and using these flexor muscles in the hand and in the wrist. So we want to keep that in mind when I'm going to be speaking later on about preventative and recovery measures. There's also other factors that can contribute to carpal tunnel syndrome. There can be a fracture in one of the carpal bones. It can be directly causing it, or it can be farther down the line where osteoarthritis occurs and it changes the size or the shape of the carpal tunnel. Hypothyroidism is a contributing factor. Also, pregnancy and diabetes are contributing factors. When we speak about sports, this is what this is all about. This is Dr. Ozello's Sports Medicine Report. There are several things, actually more than several. There are numerous things that can contribute to carpal tunnel syndrome. Like I mentioned, carpal tunnel syndrome is common in cyclists and mountain bikers. Mountain bikers start gripping the steering wheel. There's a lot of bouncing. There's a lot of vibration. Cyclists are constantly holding their hands in the same position for a long period of time. They may be gripping the handlebars too tight. Those are two key factors when we speak about the contributing factors for carpal tunnel syndrome. Also, constant flexing of the wrist or repetitive flexing of the wrist. This can cause a strength imbalance between the muscles in the anterior part of the wrist and the muscles in the posterior part of the wrist and forearm. So there can be a strength imbalance. These muscles in the front of the forearm can overpower the muscles in the back part of the forearm and in the hand. So that is a contributing factor. Also, when we speak about just constant gripping, I talked about football players, I talked about wrestlers, weightlifters, they're constantly gripping. So that can be a contributing factor also especially if someone is gripping with the wrists in a flexed position. That can contribute even greater to the formation of carpal tunnel syndrome. Other factors in sports that can contribute to the formation of carpal tunnel syndrome are inadequate rest between training sessions. I say this in almost every video, but this is extremely important because this can be a key factor in this condition. It can be an overuse cause in sports where we are doing so much training, we are not giving our bodies adequate rest between training sessions, not letting the muscles recover and grow and get stronger, not letting them recover from your training. You want to make sure you get adequate rest between your training sessions. Also, gripping and squeezing the hands while we are running. I see runners do this all the time. They start gripping right here and they start to cause problems, not only carpal tunnel syndrome, but they can get problems throughout the entire arm and the neck. And then also a lot of runners will hold their hands like this because they don't want to grip, but they're also holding their hand very, very tight. You want to keep your hands in a loose position while you are running. When we speak about any type of nerve entrapment or nerve impingement condition, which carpal tunnel syndrome is, like I said, it is entrapment, some type of compression and traction on the median nerve. But when we speak of these types of conditions, there is a phenomenon called double crush phenomenon. Some people call it double crush syndrome. It's also known as multiple crush syndrome or multiple crush phenomenon. What that means is when there's an impingement on a nerve, there can be an impingement on that same nerve or the nerve root in a different area along the course of the nerve. The nerves that branch off the neck, they go into the neck, the shoulders, and down into the arm, hands, and fingers. Spinal nerve roots branch off the spinal cord in the neck. They come down here, they form a network of nerves called the brachial plexus, and the median nerve originates from the brachial plexus and then has branches that go all the way down into the hand. If there's an impingement on the median nerve right here at the carpal tunnel, there can also be impingement or nerve entrapment, nerve encasement, whatever terminology that you want to use in another area. It can be in the cervical spine where the nerve root is being impinged. It can be in the brachial plexus. It can be in the elbow or along the entire course of the nerve in the forearm or at the wrist. So when we speak about any type of nerve entrapment condition, there can be multiple areas along that course of the nerve where the nerve is being entrapped or the nerve is being compressed. Symptoms of carpal tunnel syndrome are pain, burning, which is called paresthesia, numbness, tingling, and weakness along the distribution of the median nerve. Usually in the beginning stages, this is felt at nighttime. It may wake you up during the night, or you may wake up in the morning with that numbness, with the tingling, with the burning into the hand. Usually just shaking the hands, moving the wrists, moving the forearms around a little bit will help to lessen that sensation. But as this condition gets worse, it starts being felt during the day, especially when doing repetitive type of motions or when holding the wrist and forearm in one position for an extended period of time. There can be clumsiness, dropping things, lack of coordination in the hand. And then as the condition progresses even more, when it gets into the later stages, there is weakness in the hand. There can be atrophy in this area right here. This is called the thenar eminence. When you see someone with long-standing carpal tunnel syndrome and you look at their hand, this area, the muscle is just wasted away. The muscle has atrophied. So the thenar eminence, the muscle is almost gone in that area. That is one of the symptoms of a long-standing case of carpal tunnel syndrome. If symptoms of carpal tunnel should occur, especially in the early stages, you start to wake up during the night or you're waking up in the morning with these symptoms of carpal tunnel syndrome, take action immediately. Do not hesitate. Do not wait to see if the pain or symptoms will go away. Because even if those symptoms start to lessen, the source of the symptoms is still there. So take action immediately. Seek professional care. Get a correct diagnosis. When you see a medical professional about carpal tunnel syndrome, you will have a history taken, an examination. There may be imaging done, especially if you've had a trauma to that area. We want to make sure that there is not osteoarthritis that can be a contributing factor to the carpal tunnel syndrome symptoms. There may be some special testing done. Could be an MRI, could be a CT scan, also a nerve conduction velocity test, which is going to test the strength and the speed of the nerve signal going through the carpal tunnel compared to nerve signals that do not go through the carpal tunnel. So this is extremely important. Please do not hesitate. Seek professional care. And the reason that I say this is because a nerve impingement condition, it can have a cascade of physiological problems. It can lead to many things, including disability. It can lead to cessation of working, or if you're an athlete, cessation of these activities that you love to do. So please do not hesitate. This is extremely important. Take action immediately. As a doctor of chiropractic, this is a condition that I see in my office all the time. Carpal tunnel syndrome, again, is impingement on a nerve. As a doctor of chiropractic, one of the main things that I treat is nerve impingement conditions. I would look at the entire course of the nerve. I would start doing an examination and also treatment on the cervical spine, on the upper thoracic spine, on the shoulder, on the elbow, on the wrist and hand, everything in that kinetic chain going from the course of the nerve, starting in the nerve roots up in the cervical spine, going all the way down into the hand. Because we want to eliminate the intrinsic sources of this condition, which are the sources inside the body, and then I'm going to teach you patient education that you can do outside of the office to eliminate the extrinsic sources of this condition. So you want to take action immediately. Get a professional diagnosis. Please do not diagnose yourself. Get a professional diagnosis. This will help send you on the correct path to recovery. See a doctor of chiropractic. It will help you to restore the proper nerve flow from the spine going down into the extremity. Please do not hesitate. I know I've said this several times. Long-standing nerve entrapment conditions can have a serious sequela. And in most cases, the earlier that treatment begins, the less time that there is compression on these nerves, usually the quicker the recovery is, in most cases. I mentioned patient education, and patient education is part of professional treatment, but it is the self-treatment that you do on yourself, and it's also the things that you do outside of the office to help yourself. First of all, we want to eliminate any of the contributing factors. It is the repetitive motion from your work, if it is the repetitive motion from computer work, from mousing, from holding position too long, you have to modify that. Because if you do not eliminate that causative factor, the condition is just going to keep recurring and recurring and recurring. It is a vicious cycle. So you need to eliminate the causative factors. You need to modify your body positions. You need to set up your workstation a little bit better ergonomically. When we're thinking of sports, and we're speaking about sports and training, you need to modify your training. There's no doubt about it. You get more rest between the training sessions. You need to look at your nutrition, figure out if there is a vitamin deficiency or vitamin toxicity that is contributing to this condition, and eliminate that deficiency or that toxicity. Look at your nutrition. Eat anti-inflammatory foods to help to reduce inflammation. This will help you get healthier overall. When we speak about carpal tunnel syndrome, you want to do some mild stretching the flexor muscles in the wrist. You want to do some strengthening exercises for the muscles in the back part of the hand and the forearm, especially if there is a strength imbalance. This will help to eliminate the strength imbalance. If the strength imbalance is a causative factor, then eliminate that strength imbalance with some mild stretching and some mild strengthening exercises. Also, you can do nerve slide motion exercises. Nerve slides have many names. I like to call them nerve slides. They're also known as nerve glides, nerve flossing, and neural mobilization. Nerve slides are non-resistance motion exercises that help to lessen scar tissue encasement on nerves. When we are speaking about training or when we're speaking about sports, you want to make sure, again, that you get adequate rest between your training sessions. You use proper technique. You hold proper posture while you are exercising. You want to eliminate strength imbalances. You want to stretch the muscles that are tight, that have a large amount of tension and that lack flexibility. And you want to strengthen muscles that are weaker. Obviously, that sounds like common sense, but strength imbalances are a common contributing factor for a large number of issues, and they are also one of the contributing factors for carpal tunnel syndrome. So you want to eliminate those strength imbalances. Do not hold a fist while running. Do not hold your hand in a tight position like this while you are running. Keep your fists loose while you're running. While you are cycling, while you are mountain biking, continually try to switch your hand positions. Every minute, every few minutes, whichever works better for you, just put your hands in a slightly different position. Try not to grip the handlebars extremely tight throughout your entire ride. Whenever you get a chance to, lift up the hands, move them around, move the wrists around, move the elbows, even the neck and shoulder if you get a chance to while you're riding. You have to be safe, obviously. Be as safe as you can. But if you get a chance to just move the wrists and move the hands around, break that static positioning, that will help you a great deal in the prevention and the recovery from carpal tunnel syndrome. I didn't mention too much about prevention. I always speak about prevention, and I'm going to say the same thing I say in every video. Prevention is easier, faster, and less expensive than injury rehabilitation. So do everything in your power. Use every resource that you have to eliminate any contributing factors of carpal tunnel syndrome before it begins. Prevent this condition, and you will do yourself a big favor. If symptoms start to occur, then seek professional care immediately. Take action. Do not hesitate. Some other things that you want to do, just speaking about ergonomics, if you are on a computer, do not hold the wrist down on the desk or the table. This can place direct pressure on the nerve and can press down on that area and lead to the symptoms. Keep your wrists in a neutral position. Do not have the wrist flexed. Do not have the wrist extended. Do not have them ulnar deviated or radial deviated. Keep the wrist in a neutral position whenever possible. Take frequent breaks. Break the static positioning. Every 15 minutes or every 20 minutes, stand up, move your wrists around, move your elbows around, move your neck, reach towards the sky, reach out to the side, stretch. Anything that you can to break that static position. You could do nerve slides when you're taking a break. Once an hour, get up and walk around. Go to the bathroom, get a drink of water, do whatever that you need to do. That will help you a great deal to prevent this condition. I mentioned water. Stay hydrated. That will help you a great deal in any type of health condition. Drink plenty of water. Do everything that you can to eliminate the contributing factors of carpal tunnel syndrome in prevention mode and in recovery mode. Other things that you want to think about in the prevention and the recovery from carpal tunnel syndrome is try your very best not to grip with the wrist flex. This can place a large amount of tension on the muscles and on the carpal tunnel because you're using the muscles that are, the tendons are going through the carpal tunnel. I mentioned the bike, how you want to constantly change your hand position, but the same thing on any piece of exercise equipment. If it's a treadmill, if it's the elliptical machine, if it's a stair climber, constantly change your hand positioning. This will help you a great deal. Stay in good posture when you're on the machines and make sure that you are doing everything you can to constantly change your hand position and keep your body in a good position. Thank you everyone for viewing today's episode of Dr. Ozello Sports Medicine Report. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance and Minimize Injuries. Thank you for viewing today's episode. Please feel free to like this video. Please feel free to leave questions, suggestions, or feedback in the comments section below. Please subscribe to my YouTube page. Dr. Ozello Sports Medicine Report is published every Thursday, and my other show, 2 Minutes of Anatomy, is published twice a week on Monday and Friday. Thank you very much for viewing today's episode. Do everything you possibly can to prevent carpal tunnel syndrome and to recover from carpal tunnel syndrome. Always remember, train hard, train smart, stay injury-free, and accomplish your goals.